Alrighty, hello everyone. All right, I'm going to give people just a few seconds to jump on here. I can adjust my lighting. Hello to my first viewer. I don't know who you are, but if you could just type in the chat. Welcome, welcome, welcome. Appreciate you tuning in tonight. If you could just type into the chat. One, you're going to help me do my sound check. So if you could just type in the chat, if you can hear me, thumbs up or thumbs down. Hey, cousin, how's it going? Are you able to hear me? You're going to help me with my sound check since you are the first one here. If you are able to hear me, just type in the chat, yes, I can hear you, or no, I cannot. Yes, awesome. You can hear me. Okay, great. Thank you, thank you, thank you so much for that, cousin. I appreciate it. I am experimenting tonight with a new streaming service. You know, I had some issues in the past with BeLive, and now we are trying StreamYard. So I am going to experiment with this for just a little bit, and believe it or not, I think I'm going to be able to go to Instagram as well. Actually, not live on Instagram. Hey, Miss Monique, how's it going? Thanks so much for tuning in. I appreciate it. Thank you to all of my viewers. I'm just going to give it just a few minutes, okay? Probably about one more minute to allow a couple of other people to join us. And I am going to use my phone here, and we're going to go on Instagram TV so I can see if I can simultaneously live stream. How's everybody doing tonight? Why don't we start with that? How's everyone doing? Yeah, check out StreamYard. So far, I've actually been a guest on someone else's live stream, and they use StreamYard. It was actually pretty good, so I'm going to try it. Currently using BeLive. Okay, I tried BeLive as well, and I don't know, no disrespect to them, but I just had some issues with that. So, all right. Well, we are going to go ahead and get started. I know we've got someone from DC, Miss Monique. Why don't you put in the chat where you are tuning in from, if you feel comfortable to do that. If not, that's okay. And hello to my third viewer. Hopefully we'll get some more people here, but thank you so much. I appreciate all of you for coming in tonight. We are going to be talking about a tale of two pandemics, about COVID-19 and obesity. Let me just get my Instagram started here. Okay, all right. Hello to everyone out there on Instagram. So we are going to go ahead and get started. For those of you that don't know me, welcome. Chi-Town. All right, Miss Monique's coming from Chi-Town. That's exactly where I am too. I am Dr. Rene, board certified family medicine physician. Now dubbing this the virtual house call with Dr. Rene. You know how I love to come and share some health information with all of you. So we are going to have a discussion tonight about an imperfect pair, COVID-19 and obesity. There is a lot of talk about this going on in the media, in the news, both print, online, television. Definitely, I feel like a conversation worth having. So we are going to dive right in tonight. Obviously, if you all have questions, feel free to ask me. You can just type them in the chat because obviously I can't see you, but you certainly can type them in the chat. I will do my best to answer your questions. If you know someone that might benefit from this information, by all means, hit that share button on Facebook. I am more than happy to have others join us tonight. If you're not able to catch it live, then you can catch the replay. You can just type in hashtag replay so I know that you are watching it for the second time, or it was not live. But thank you so much for tuning in. Again, my name is Dr. Rene. Okay, you can find me on social media. There's something scrolling at the bottom of your screen there, so you guys can check that out. So let's get started tonight. Thank you so much for tuning in. We are going to talk about an imperfect pair, COVID-19 and obesity. It is literally like a tale of two pandemics. Obviously, none of us were prepared for the coronavirus, had no idea that was coming, so that was a huge surprise. But obesity, particularly here in the United States, has been an existing pandemic for quite some time. People may not want to call it that, but it is what it is. We have definitely struggled with that here in our country. So just some quick facts for you. We know obesity is a complex issue. Just as a refresher, when we are actually classifying obesity, we are talking about that based on your BMI or body mass index. Hello, Miss Cynthia. Thank you so much for tuning in tonight. We're basing obesity on what we call the body mass index, which is kind of a measure essentially of how fat we are, okay? Now, there can be variations, obviously, based on your body mass, muscle mass, that type of thing. But obesity is defined as a body mass index greater than 30. And then we also have what's called severe or extreme obesity, and that would be a body mass index greater than 40. For those of us that are striving to be in a normal weight range, our BMI should be between 19 and 24, and those who are considered overweight, actually 24.9, guys. Once you hit 25 to 29.9, that is considered being overweight. So, all right, just a little background knowledge. The crazy thing about obesity and this COVID-19 pandemic is that particularly here in the United States, it is turning out that your BMI is literally going to determine in many cases whether you survive or succumb to COVID-19. So I found something when I was doing research for this live stream that I thought was very interesting. So we obviously know this started in China. We know Italy got hit very hard. So one of the main complicating factors for the COVID-19 infection in China was actually smoking and air pollution. On average, people in China tend not to be obese compared to what we have here in the United States. Then let's fast forward to Italy. Italy's big complicating factor was in actually the age of their population. They actually have the second oldest population behind Japan. Okay, so China, it was smoking and air pollution was a big complicating factor for, severity of COVID-19 disease or mortality from COVID-19. Italy, their complicating factor was actually old age, okay, having the second oldest population in the world. And now here we are in the United States. And our confounding issue is obesity. And particularly for those people that are under age 60. Let's see here. Cousin's checking and he says, what is a reasonable BMI for the average person? Okay, so that is a great question. Reasonable is going to be relative because I always think you have to take in to account how you carry your weight, okay? Some people might be real skinny, some people might be super, super tall, but they have a ton of muscle mass, which actually causes them to weigh more. So technically their BMI might be a little bit higher. So ideally what they're classifying as a normal BMI, okay, is anything from 19 to 24.9. Okay, now I personally like to take into account body, your muscle mass and how you carry your weight. Based on my height and weight, I'm actually classified as being overweight because my BMI teeters between 24, 24.9 and 25 when I'm not being very good. So I wouldn't consider myself overweight, but based on that BMI, they're saying that I am. So if you want to just do rough and cut numbers of BMI between 19 and 24.9 is considered ideal. So back to, so great question. Thank you so much for that. Again, if you guys have questions, feel free to type those in the chat. So again, one of the things that I thought was found was very interesting was these complicating factors. China, it was smoking and air pollution. Italy, it was the old age of their population. And for the United States, our complicating issue is obesity. I know when this whole pandemic first came out, they were talking about, oh my gosh, it's only old people. You know, the young folks were like, I'm good. I'm about to go out and live my life. I'm about to live my life like it's golden. I don't have to worry about this. And then all of a sudden, they started realizing, wow, we are having a large number of deaths that are occurring independent of the older generation or people with comorbidities such as, you know, diabetes, hypertension. But they found out that the majority, about 60%, okay, of the deaths that were occurring in younger individuals, so most research is defining this as age under 60, was due to obesity. So let's crunch some numbers, and let me say hello to a couple people who have tuned in here. Lavon, thank you so much for tuning in tonight. We have Miss Cynthia here, thank you. We've got Monique, we've got my lovely cousin here. Gotta keep it in the family. Thank you so much for the support. And if anyone else is tuning in and you are not shy and want to let us know that you're here, please do so. So the numbers are not very encouraging. Okay, here in the United States, 35% of adults who are age 65 and older, okay, so age 65 and up, 35% are considered obese. So again, that's BMI of 30 or higher. Extreme obesity would BMI of 40 or higher. Now, listen to this. I thought this was extremely interesting. So if we're talking about people in the United States between the age of 20 and 60, so that's quite a few of us. I fall in that category. Most of my audience tonight probably falls into that category. 42%, I'm gonna say it again, 42% of people in the United States aged 20 to 60 are considered obese. Okay, so let's talk about this. These are people, this is when we are in the prime of our life, okay? Between 20 and 60, 60 is probably the new 50, 50 is probably the new 40, and 40 is the new 30, okay? But we are literally talking about 42%, that's almost half, not quite, so not quite 50%, but we are talking almost half of persons in the United States between age 20 and 60 are obese. Not even overweight, we're talking obese, okay? And so that is going to create a lot of potential health complications, and that is exactly what we are seeing right now with the COVID-19 pandemic. Let's say hello to Miss Danny. Thank you so much for tuning in, and Gannett is here. Thank you, ladies, for tuning in tonight. I appreciate that. Make sure, if you're enjoying this, make sure you hit that thumbs up button, or if you love it, hit that heart button. Let me know you're enjoying this content. Okay, so people in the prime of their life, 20 to 60, here in the United States, 42% are obese. So what they have found too is, you know, obviously there's tons and tons of studies going on right now as this COVID-19 pandemic continues to unfold. And they are finding that a large number of people who are getting admitted to the ICU, getting hospitalized, let's start with that, let alone getting hospitalized, and then those ending up in the ICU are actually obese. So again, obesity, a complex issue. It's going to come with its own set of problems. We know people that are obese are going to be at a higher risk for having high blood pressure, hypertension, which is high blood pressure, high cholesterol, and increased blood sugar, most commonly in the form of diabetes. The other thing too that is complicating the situation is mobility issues, okay? Carrying a larger body mass is going to make it harder to move around, harder to walk, harder to get physical activity in. And then in particularly for these patients that are obese and getting admitted to the hospital, we're finding due to their large body mass and mobility issues, the rate of pressure sores, or what we consider bed sores out in normal people, talk layman's terms, bed sores or pressure ulcers as we call them in medicine, their risk is actually higher for that. So big takeaway points here too is that obesity, okay, can complicate COVID-19 infection because obesity brings with it so many problems, particularly its impact on the immune system. Hey, Dr. Janine, thanks so much for tuning in tonight. And hey, Marcus, all right, we've got 2 more people tuning in tonight. Great to see you guys. Obesity can impact our immune system, okay? Carrying the extra weight actually weakens the immune system, increases the amount of inflammation in the body. There's lots of talk going on about the harmful effects of inflammation that can occur inside the body. If we want to go all med school and science nerd for about 2 seconds, okay, the inflammatory response is mediated by these substances called cytokines. I'm not going to make sure that this conversation goes over anyone's head, but for those of you that want to do a little bit more research, the cytokine response, okay, in terms of inflammation is enhanced, okay, in people that have obesity. So the cytokines are essentially these substances that actually facilitate communication between immune cells. And in people that are obese, that communication is hindered, okay? So your body's ability to like mount an efficient immune response. So that means, hey, I just got sneezed on. Someone on the train just coughed on me. They've got COVID-19. Now that virus is inside my body. How my body responds and reacts to that, how my body mounts that immune response is greatly impacted when someone is obese. Okay. The other issue too, let's talk about the increased body mass, okay, and how this impacts COVID-19 infection. You have to think about it this way, okay? Unfortunately, the obesity puts a patient, particularly those young folks between 20 and 60, at increased risk for hospitalization. Because again, not everybody that has COVID is getting hospitalized, okay? There are people that are getting it, tons of asymptomatic carriers who have it and don't know it, and they're sitting at home, or they know that they have it, but their symptoms are not serious enough that warrant them going into the hospital. But for those that are sick enough, okay, obesity increases your risk of 1, having to be hospitalized in the first place, and then 2, it increases your risk for ICU admission, intensive care unit admission. When we're in the hospital, when an obese patient with COVID-19 is in the hospital, it creates another set of challenges. Particularly 1, increased body mass is going to make it really hard to move around inside your bed. One thing when I was in residency, in medical school, they always pounded this into our head. You got to make sure that your patient is staying mobile. If they're not able to be mobile for various reasons, maybe they had like a hip replacement surgery, knee surgery, that type of thing, then you have to make sure that that patient is being rotated, because sitting down, lying down, whether it's on your side, whether it is supine, like we call that, lying on your spine, on your back, over long periods of time is going to create a problem, particularly skin breakdown. Think about someone that may not have control over their bowel or bladder function. They've actually gone to the bathroom on themselves. Now they're wet, they're damp. Nursing hasn't gone in just yet to change them. And now we've got the perfect setup for infection and skin breakdown. So that can definitely complicate things. Even for the hospital staff, the doctors, the nurses, the CNAs, the techs having to come in and actually rotate that patient or do body changes, that presents a challenge as well. Just due to the increased body mass, it's going to make it harder to rotate that patient. One thing that can happen, particularly with the respiratory system, especially in obese patients, and particularly if they are carrying their weight around their midsection, particularly around their chest, okay, as opposed to someone that's carrying all of their weight in their thighs and their butt and their hips, okay? But if you're carrying a lot of your weight around your chest, that is going to make it harder to breathe. It is going to decrease what we call the functional capacity. It's essentially like how much air is in your lungs at a given moment that's available, okay, for oxygenation. The other thing, too, is that a lot of people with obesity may already have existing respiratory issues, particularly asthma or COPD, which is chronic obstructive pulmonary disease. So we factor that in, and it makes the risk, okay, for adverse outcomes with COVID-19 infection. It definitely increases that risk, okay? There is an increased risk of respiratory complications in patients that are obese and have COVID-19 infection, particularly in the hospital, particularly in the ICU, okay? The other thing is too, is that in obese patients, because of the increased body mass, particularly around the chest, the alveoli, so you're like, whoa, hold on, Dr. Rene, using some big terms here. Alveoli are the little tiny sacs. They're super, super tiny, okay? And they look like a bunch of grapes. Literally, if you were to go to the grocery store and pick up a bunch of grapes, okay, all clustered together, that's what your alveoli look like. They are very, very tiny, air-filled sacs, and they have a very rich blood supply. And this is where the gas exchange occurs. So when I breathe in air, I'm taking in oxygen, and I'm exhaling out carbon dioxide. The exchange of that oxygen for carbon dioxide actually takes place in these areas at the very end of our respiratory tree called alveoli. Well, in patients who are obese, okay, and just in general, without even having COVID-19 infection, they actually have decreased ventilation. So that exchange of oxygen and carbon dioxide tends to be decreased in patients with obesity. Now you throw in a COVID-19 infection and you are setting yourself up for a lot of respiratory complications. And this is part of the reason why they are getting such poor outcomes, okay? And the mortality rate is higher in obese patients with COVID-19 infection. The other thing too, let's say, unfortunately, they end up in the hospital, they end up in the ICU. What are we hearing about? Where's the ventilator? We're running out of ventilators. The issue too is trying to intubate. So intubate is essentially when you are not breathing or having a hard time breathing, and it's time to hook you up to that ventilator to help you breathe. Obviously, it's going to be a process. They're going to have to take a tube and get that down into your trachea, your windpipe. Now, having excess weight, excess fat tissue around your chest, it just makes intubating a lot harder, okay? Unfortunately, I found this to be, quite sad. The mortality rate actually, or excuse me, the survival rate, the survival rate for obese patients with COVID-19 infection is 30%. 30 to 40% is what a lot of studies are saying. If the person is obese, has COVID-19 infection, and is on a ventilator, so essentially intubated, the survival rate is only 30 to 40%. So unfortunately, some grim numbers there. Hey, Dr. Leslie, thank you so much for tuning in tonight. Appreciate that. So the other thing too, and God forbid, we've been hearing about this a lot, is, there's lots of respiratory complications, ARDS, acute respiratory distress syndrome. Unfortunately, what can happen there is the patient can go into cardiopulmonary arrest. So essentially that means your heart stops, your lungs stop working, and that is what we call a code, or code blue, as you guys are used to hearing that. The overall process of even trying to survive a cardiopulmonary resuscitation, chest compressions, that type of thing, is a lot, the survival rate is a lot less, okay, in someone with obesity. So it tends to be a lethal risk factor, okay, particularly in persons aged 20 to 60. Now, I thought this was interesting, okay? Let's take a step outside of the hospital now. I'm going to have this hit a little bit closer to home. It is a complicated issue. Coronavirus is a complicated issue because what have they been telling us to do? Stock up on food, stock up on groceries, get canned goods. Okay, well, that's going to be an issue for a lot of us because in order for food to sit on a shelf, they have to do something to it and take it out of its natural state. I talked about this Sunday night during my live stream about COVID-19 and diabetes. The issue is if I'm going to sit on a shelf in a can, in a box, whatever, then a lot of that nutritional value has been stripped. They're going to have to pump it full of salt, pump it full of sugar, pump it full of fat or some other type of chemical or preservative that is going to decrease the nutritional value. So someone can definitely be at a loss because what am I supposed to do? I need to stock up on food, which I get, okay, because we are not sure how long, this stay-at-home sheltering in place order is going to go. But then at the same time, I need to keep my body healthy. So I'm obviously not here to tell you what to do, but I am going to say this. My recommendation obviously would be to try to limit your intake of canned goods if at all possible, especially if you have obesity or any weight issue for that matter, or even if you want to try to lose a little bit of weight, because it is going to be extremely difficult to try to combat the added salt, fat, sugar, chemicals, a lot of which actually promote weight gain. So that is something that I thought was interesting. These are issues that obese individuals are having to deal with. These are times where people are having to make some very difficult decisions. The other thing too, it's almost like people are being forced to be sedentary. It's hard. People with obesity may already have pre-existing mobility issues. Maybe someone has joint pains, arthritis, lots of things that can contribute to decreased mobility. Now you're telling us that we need to stay at home, which I agree with. Again, don't mark me wrong. It is extremely important. We do need to shelter in place so that we can flatten the curve. But what happens when you're obese and you already have mobility issues? A lot of people might be cohabitating, having multiple generations now under one roof. People might be living in a very small living quarters, okay? People may used to say, hey, I don't have to spend time at home. Pre-COVID, I could just go hang out in the street. I could go to work. And the only time they would come home is in the evenings to eat, shower, and go to sleep, whatever. But now you may have multiple people under the house, or multiple people under one roof all at one time. And that may decrease one's ability to be able to move around freely in their place of residence. So now it's like, well, and you're forced to be sedentary, may not have the availability. Not everybody lives in a big 5-bedroom home. Not everybody has a backyard, that they can go out and walk around and run and stretch their legs. Okay, so these are some issues that are facing folks with obesity and honestly people without obesity, but the challenges are obviously greater, okay, for those people. Dr. Leslie says canned food. Yes, Dr. Leslie, that is so true. Canned food loaded with additives and preservatives. Absolutely right. So the other issue is, this forced inactivity, so to speak, especially if you've already had, mobility issues or limited, from either arthritis or maybe you've had a foot issue, sprained ankle, ulcer, that type of thing. Now I am going to sit down and forced to be less active, which can actually promote more weight gain and add to the complications. So one thing that I did find doing research, because I love to do some research, is that there is not a good solution to this problem, unfortunately. We can't just snap our fingers and click our heels 3 times and wish obesity away, okay? Especially here in the United States, we have created this problem, created the drive-through, created the 24-hour all-you-can-eat you know, wing stop, pizza place, hamburger joints. We have a lot of access to a lot of the wrong foods, and literally can get as much of it as we want for the most part, which is not helping us. So it's hard at this point. We can't wish obesity away. If someone has obesity, or if you have a loved one that has obesity, obviously you're concerned for their health and for their well-being, but that's going to make it a lot harder. We can't just wish 100 pounds away or 50 pounds away or whatever it is that they need to lose in order to be at a more healthy weight and decrease their risk for infection of any kind, but particularly COVID-19. So that being said, we're going to have to take baby steps. We're going to have to take baby steps. We're going to have to take things one day at a time. Definitely recommend celebrating these small that is obese, which is pretty much going to be every person for the most part. We've either been affected by it personally, or we know someone, or know someone that knows someone. We need to find ways to be supportive, ways to help that person. If you know that someone is having these issues, struggling with mobility, provided that you can social distance well enough or wear a mask, give them a call, check up on them, see how they're doing, see if they need assistance. Maybe they're not mobile enough to be able to get out and go to the grocery store. Maybe they just don't want to go, you know, out of fear for potentially being exposed to the virus. Maybe you could offer to shop for them. Grocery delivery service. This is some of the suggestions I had too for the diabetes talk that I did on Sunday. Now is a great time, if you are not very mobile, to get mobile. Okay, I know it's hard. Well, what can I do? I don't like working out. There is something you can do. Some movement is better than no movement at all. Even if we do chair exercises, I know we used to remember the Sit and Be Fit. I don't know if anybody remembers that. This lady that used to do this, I think on PBS, and I used to laugh and be like, what is she doing? Trying to do little arm exercises and leg exercises from a chair. But she was onto something, because you actually can get a decent workout in, particularly if you are completely sedentary, you don't move around a lot. Anything to get the joints moving, to get the blood circulating, to increase that oxygen and nutrients flowing to your tissues and your organs, particularly your heart and your brain, are going to be of great benefit for you. I'm always a big proponent, of course, of asking for help and getting help if you need it. If you struggle with food, if you struggle with either overeating, binging, purging, you know, and eating what we consider an eating disorder, if you don't have the healthiest of relationships with food, it is never too late to make positive changes. It's going to involve you being very honest with yourself, taking the veil off, okay, and facing the situation for what it is. If you hide from it, then that's not going to help the situation. But now that we're forced to be at home, this might be a great time to say, hey, what is it that I need to do for myself to be able to work through these issues? A lot of people, again, not everybody, but I know there's quite a few people that eat for the wrong reasons. We don't eat for nutrition. We eat because we're trying to numb pain. Maybe someone has been abused, physically abused, sexually abused, emotionally abused, experienced a lot of childhood trauma, teenage trauma, young adult trauma, whatever the case may be. A lot of times people will reach for a vice. They'll reach for alcohol, they'll reach for food, some people reach for sex, some people reach for bad relationships, whatever the case is. If you are that person and you are reaching for food as therapy, then I'm going to encourage you to speak with someone, a professional, speak with a family member, clergy, whatever the case may be. But it's time to start working through those issues, because as long as you continue to eat for the wrong reasons, the problem will not remedy itself. And I can understand it can be very difficult. A lot of people have a lot of hurt, a lot of pain, a lot of trauma, and food is a great therapist. It's readily available, it feels good, it tastes good, it doesn't talk back, it doesn't judge. But ultimately, what is that doing for your health. And of course, as we kind of mentioned before, stay connected, ask for help. There's plenty of online therapists, telepsychiatry, therapy apps, okay? There's no stigma attached. Don't think that there's a stigma attached. There are definitely resources available to you to help you through this difficult time. So, goodness, that was a lot of talking, but I am going to open it up for some questions or comments. If anyone has anything that they would like to share or add, by all means, you are welcome to do that. If you guys are interested in following me on social media, I got something scrolling for you at the bottom there, so you can find me on social media at Dr. Rene MD. Actually, Twitter, I'm on Twitter, but it's actually at Dr. Rene Roberts. Let me see if I can type that in the chat here. Dr. Rene Roberts, because somebody already had Dr. Rene MD, so that is okay. We'll pop that in there. There you guys go. Okay, so I want to thank all of you for tuning in. You have been watching the virtual house call with yours truly, Dr. Rene, board certified family medicine physician, having a conversation tonight about a tale of two pandemics, the imperfect pair, COVID-19 and obesity. I will be making this video available on my YouTube channel, okay, so it will be downloaded. And if you missed Sunday's discussion about COVID-19 and diabetes, getting your game plan together to help yourself out or your loved one that has diabetes, that is available on my Facebook fan page currently at Dr. Rene MD, where you're watching this broadcast. I will also make that video available on my YouTube channel as well. So thank you so much, Dr. Leslie. I appreciate that. Dr. Leslie is one of my medical mogul super friends and photographer extraordinaire. Oh my goodness. She is fantastic. Thank you so much, Leslie. Thank you so much, Gannett, for tuning in. Dr. Janine, Marcus, Danny, my cousin. Thank you so much, fam. I appreciate that. Lavon, Cynthia, Monique. I appreciate it. If I missed anybody, I am so sorry. You better type in the chat real quick and say, hey, Dr. Rene, I'm here. But I appreciate all of you so much for tuning in. I will be going live again. This coming Friday, actually, I will be with doing a joint live stream with one of my medical mogul super friends. Dr. Leslie knows her as well. Dr. Ferlandi, she is a naturopathic physician. We actually have created a group, soon-to-be group, for people that want to have a healthier relationship with food. So it's entitled Food Freedom Fridays, okay? We will be live streaming. We're alternating right now, so one time it'll be on her Facebook page, the other time it'll be on mine. I believe this Friday it's going to be me. So that's why I was experimenting with some new streaming platforms here. So 7 p.m., I'll type this in the chat, Food Freedom Friday, 7 p.m. Central Standard Time. We are going to be talking about ways in which you can develop a healthier relationship with food, because let's face it, y'all, food is a drug. Everyone's got their vice. Cinnamon Toast Crunch got me. Y'all heard my conversations about me and Cinnamon Toast Crunch during this pandemic. So if you struggle with that, or if you know someone that does, by all means, you can tune in this coming Friday. You know how we do it. I'll be on social media. I will be promoting that, so you will know where to tune in and when. Thank you so much, Dr. Leslie. Thank you so much, Gannett. Thank you, Marcus. I appreciate all of you tuning in. Hit that thumbs up button, the blue thumbs. If you loved it, hit the heart. And please be sure to tune in to my next live stream Friday. And I will probably be back again Sunday for my next virtual house call, maybe sooner. So you guys have to tune in. Thank you so much. I am Dr. Rene, MD, board certified family medicine physician. You have been watching the virtual house call with Dr. Rene talking about COVID-19 and obesity. I love you all. Thank you so much for your support. Wow. Have a great evening.